Hello everyone and welcome to our free clinical pharmacy course available here on YouTube, on our YouTube channel. My name is Joe Rudy. I'm a clinical pharmacist with over 25 years of experience and founder of clinicalpharmacycourses.com. In this course, you will gain an introduction to the essential roles, responsibilities, and daily practices of a clinical pharmacist. And this has been demanded by a lot of people who do not have the knowledge of what a clinical pharmacist is and what they do. So I decided to create this free course to show you a little bit and give you a little bit of information about what clinical pharmacists do and our daily work, what areas you need to focus on, and how your practice will be as a clinical pharmacist once you advance your career. This free course is designed to help you understand the foundations of clinical pharmacy and see how pharmacists play a vital role in improving patient outcomes. It's a great starting point if you are a pharmacy student, healthcare professional, or simply curious about what clinical pharmacists do. And please note that this introductory course does not replace the complete clinical pharmacy program we have on our website. The full course on our website dives deeper and has a complete didactic courses with a complete training and practice residency that is not going to be offered obviously in this free course. However, it's still a good starting point for those who are willing to learn about clinical pharmacy. Now, for those of you who are new on the channel, this channel is all about clinical pharmacy practice, and we also help you with immigration to Canada if you have any questions or need any information about that. So if you're new here, make sure to subscribe to the channel and activate the bell so that you get notified of our future videos. Now let's get started with our free clinical pharmacy course here, and our objectives throughout this course would be to understand what is clinical pharmacy, understand the scope and responsibilities of clinical pharmacists, understand the clinical pharmacist workflow, and you're going to see a few samples of clinical pharmacist interview questions and a sample of clinical pharmacy practice cases as well towards the end of this video. Now, to define clinical pharmacy, you will see a lot of definitions in different organizations such as the American College of Clinical Pharmacy, the Canadian Society of Health System Pharmacists, and the National Health Society in the United Kingdom. All of them circle around the same concept. So clinical pharmacy is a health science discipline in which pharmacists provide patient care that optimizes medication therapy. So optimization of medication therapy is a very important goal and promotes health, wellness, and disease prevention. If you read through the three definitions and try to translate them and simplify them, you'll gain the same concept and the same goal around clinical pharmacy definition. So it's all about medication optimization and improving the outcome of those patients. The core focus areas for clinical pharmacists are usually optimizing pharmacotherapy, enhancing medication safety, and participating in interdisciplinary care. And we're going to talk about each one of these soon in the next few slides. But think of it as an evolution from product-centered practice to a patient-centered practice. Scope and responsibilities of clinical pharmacists. What are you going to be responsible about when you advance your career, become a clinical pharmacist, and start practicing in a clinic or a hospital or even at a community pharmacy? Number one, medication therapy management. This is very important. We're going to talk about it in a minute. We're going to dive deep into each one of these points actually in a few minutes. Number two, participating in clinical ward rounds. Number three, monitoring and preventing adverse drug events, which is very important as well. Number four, ensuring adherence to evidence-based guidelines. Number five, educating patients and healthcare professionals. So education is also part of your job and your responsibility as a clinical pharmacist. Of course, all of these involve areas such as medical, internal medicine, critical care, cardiology, oncology. Clinical pharmacists can exist in any medical area, basically. There are a few expanded responsibilities as well that you will encounter as a clinical pharmacist. One of them is protocol development and formulary management. They will ask you to create certain protocols at the areas where you practice. They'll ask you to manage the formulary, add new drugs, remove old drugs, and things like that. Research and quality improvement. They'll ask you to do research. They'll ask you to do certain quality improvement projects. And as I said before, education and training, educating students, educating your colleagues, educating physicians, nurses. That's another thing, another responsibility that falls under the clinical pharmacy practice. Now let's take medication therapy management and try to understand what exactly do you do in that. So this can include a lot of things, such as medication reconciliation. Again, we're going to explain that later. Uh, Drug therapy review and optimization. And this is very important. I would like you to take note of these because these are core duties that you're going to do as a clinical pharmacist on a daily basis wherever you practice. So number two is a drug therapy review and optimization. Number three, monitoring drug effectiveness and safety. Number four, therapeutic drug monitoring. You've probably heard of that before. Number five, participating in rounds, daily rounds. Number six, antimicrobial stewardship, which is also very important. Number seven, patient counseling and education. And finally, documentation. I'm going to add to documentation also communication. Communication skills are very important here and it's part of medication therapy management. We'll start with medication reconciliations. The first one mentioned on this list. It must be really important. And this is basically a systematic process of verifying the patient's medication history at every step of the medical care. So on admission, upon transfer from one unit to another, and upon discharge. So you have to look at all the medications and do some sort of reconciliation to make sure that nothing got missed, nothing is wrong, nothing is in excess. Maybe there's an extra medication that is not needed, and things like that. You need to identify discrepancies, such as omissions, duplications, or incorrect doses. This prevents medication errors and adverse drug events. Of course, if a patient has a therapeutic duplication or a missed medication that is really important for their health, that can affect them and can lead to sooner hospitalization, which is not our goal. Our goal is to minimize hospitalization and reduce future hospitalizations, and of course can lead to medication errors and adverse events. Moving on to drug therapy review and optimization. This is basically a comprehensive evaluation of the ongoing medication regimens for appropriateness, efficacy, and safety. And if you have taken my complete course, or if you're planning to take the complete course, we have a systematic approach on how to do that, how to do the comprehensive evaluation, and there are certain forms that you can an example, a sample form to follow to do the comprehensive evaluation in a very professional way. Um, this can include adjusting doses, route of administration, or even changing agents around that are patient-specific for patient-specific factors such as indications, renal or hepatic function, age, and weight, and other factors as well. And the point from it is to ensure therapy aligns with clinical guidelines and individual therapeutic goals. It's not a one-size-fits-all, so if this patient is taking this medication, let's say vancomycin 1 gram twice a day every 12 hours, That doesn't mean that the other patient in the next room will also, if prescribed, vancomycin will also be on the same dose, 1 gram every 12 hours. You have to individualize treatment. You have to make changes to doses. Sometimes the drug is prescribed in the wrong route of administration. The patient next in the next room requires oral vancomycin as opposed to intravenous vancomycin in the other patient, and both of them work differently and for different indications. So you have to be very careful here when you're doing the drug therapy review and optimization. All of that is being taught in detail in our complete course at clinicalpharmacycourses.com. Monitoring drug effectiveness and safety. Yes, we do that as well. You might be wondering, how am I going to monitor? We teach the different ways of monitoring on the complete course, but this is basically a way to evaluate patients' response to medications and identify any lack of efficacy or any adverse effects. Some patients may be allergic to certain medications, and as soon as you give them the medication, they start developing certain signs of allergic reactions. You have to keep an eye on that. You need to review lab results, vital signs, clinical status regularly, especially if you are in a critical care area like the intensive care unit. You would be reviewing labs and vitals, clinical status on a daily basis, and making adjustments to medications based on that. And he also recommends changes or discontinuation if the treatment is ineffective or harmful, or if the treatment is or has been completed. For instance, a patient on antibiotics for the last 7 or 10 days for pneumonia, they have completed the therapy. They don't need, they're completely okay now, clinical wise and hemodynamically, and their labs are perfect. They don't need further antibiotic therapy. You can stop the antibiotic. Most of the time, these get missed, and it will just keep continuing as long as the patient is at the hospital. Sometimes even the patient gets discharged on oral antibiotics to complete like a 21-day therapy or whatever, because nobody calculated the start date of the antibiotic. Therapeutic drug monitoring is very important as a part of our daily work as clinical pharmacists. And here you measure the serum concentration of the narrow therapeutic index drugs, such as vancomycin, aminoglycosides, and phenytoin, and there are other drugs too. And we teach you how to do that in the complete course, of course. This aids in optimizing dosage regimens to maximize efficacy while minimizing toxicity, as you all know. And you would be incorporating pharmacokinetics and patient-specific parameters to help you with the therapeutic drug monitoring task. This is a daily task. There's no running away from it, so you have to be ready for therapeutic drug monitoring. A lot of therapeutic drug monitoring if you work at a hospital. Participating in rounds, yes, expect that you will be asked to participate in rounds, whether you want to or not. You're not going to sit in an office and just do some office work. You will be visiting patients in their rooms, going around with the doctors, rounding on patients, and answering clinical questions, questions by the doctors, questions by the nurses, and also questions by the pharmacy team. So you'll be very actively engaging in daily interdisciplinary team rounds, which consists of a doctor, nurse, many nurses actually, physiotherapy, dietitian, and many other healthcare professionals with you. You would provide your input on medication related decisions, basically, any adjustments needed, and any potential interactions, drug interactions, drug disease interactions, drug food interactions. You need to be aware of all of that and enhance the team communication, which eventually leads to improved patient outcomes. So your presence in rounds is very important, and everyone would be welcoming you to be with them in the round. Antimicrobial stewardship is very important, especially in hospitals, but this can be participated in any practice area. So it can be in clinics, it can be in a local community pharmacy as well. You promote appropriate use of antibiotics to combat resistance and improve outcomes. You can also recommend de-escalation, switching from IV to oral, duration adjustments, and all of that, like I mentioned earlier. And you monitor microbiology results and infection trends. Sometimes the patient is actually on the completely wrong antibiotic that the bacteria is resistant to. So you notice that and you inform the doctor and you switch the antibiotics. You have a really great role as an antimicrobial stewardship clinical pharmacist. Patient counseling and education. This is pretty basic. You do this everywhere as a pharmacist. Um, what you might do extra here is educating patients and also family members at the bedside. Sometimes you might have to educate a caregiver that is taking care of the patient. So you provide medication related education, basically initiation of high risk medications or upon request. Um, Instruct patient on the indication, side effect, and adherence strategies and lifestyle medications. I'm sorry, lifestyle modifications. Believe it or not, we see a lot of patients that are cardiac patients who just came to the hospital with STEMI or NSTEMI or some sort of acute coronary syndrome, and they just had a couple stents implanted, and they're on all these medications, and then a few weeks or a few months later, they come back with another heart attack because they were not compliant with their medication. They didn't know that they have to take these medications for a year or longer or for life, and they basically end up with another heart attack, which is so bad and leads to a lot of loss in resources. So educating the patient on the importance of their medications and importance of compliance as well is very important. Next, I'm going to talk about documentation. And then, like I told you before, we always combine documentation with communication or good communication because both are very important for clinical pharmacists in your daily practice. So here you should be able to record all your interventions, recommendations, and monitoring plans somewhere in the patient chart. There's usually a specific place for clinical pharmacist documentation, whether it's a CPOE system or a manual like a binder, a chart, an actual chart, depending on where you practice, which part of the world, and we explain that in detail in our complete course. You should also be able to communicate promptly with physicians, nurses, and other healthcare providers, and professionally, I should say, because it's a key thing for clinical pharmacists, and you have to ensure continuity and accountability in care. And these are all very important daily tasks that a clinical pharmacist is responsible for. Now, as it comes to the extended duties, like I mentioned before, formulary management and policy development are important daily tasks that you will be asked to contribute towards wherever you practice. Whether you practice in a critical care setting or in a medical setting, it doesn't matter. You will be asked to participate in the Pharmacy and Therapeutics Committee, do formulary addition reviews, assist in developing hospital protocols, guidelines, and clinical pathways, and support cost effective and evidence based medication use, which is the main point for these health systems for you to optimize the patient outcomes and also reduce the cost of therapy um, uh, as much as possible. Another extended duty would be research and education and also participating in quality improvement projects. Um, at times, you'll find quality teams approaching you and asking you for a quality improvement project that you can do and present to their department. Um, Research and clinical studies happen all the time, especially in hospitals, because it's a perfect environment for clinical studies. You may be responsible for audits, for engaging in other ways, such as data collection in a clinical study. You will be asked to educate pharmacy students, medical residents, pharmacy residents, healthcare professionals that work with you at the hospital or at other hospitals as well. You may be asked to visit other hospitals and give some continuous pharmaceutical education. You will be asked to lead and contribute to quality improvement initiatives aimed at medication safety and therapeutic outcomes. Now, how does the clinical pharmacist workflow look like? Typically, a daily workflow would involve reviewing or starting your day with reviewing patient charts and medication history, trying to gather as much information as possible about the cases you're going to see later, and then attending multidisciplinary rounds right after that, um, performing medication reconciliation for new admissions or transfers or even discharged patients, monitoring labs, adjusting therapy accordingly, counseling patients at discharge, and documenting, of course, documenting your interventions and the patient record. As it comes to communication throughout the day, there will be a lot of communication happening, whether it's clinical handover to your fellow clinical pharmacist or from your fellow clinical pharmacist who was covering the area before you, or with the doctors, with the nurses, or with other pharmacy team. These could be verbal or written recommendations that will be handed over to you. Now, I want to give you an example about clinical pharmacist workflow for a pharmacist who worked in the ICU unit, for instance. Um, if you're working in an ICU unit, you know that this is a critical care unit. You have to have critical thinking. You need to be very, very fast with your thoughts, with your plans, with your recommendations. You need to be top notch when it comes to knowledge. And typically, an ICU clinical pharmacist would start with chart reviews. So they start really early in the morning because rounds are usually around 8 o'clock. So before 8 o'clock, you would be there reviewing charts. Depending on how many patients you have, you need at least 15 to 20 minutes to get a good idea about the patient, why they're here, and look at the vital signs, labs, cultures, medications, and all that stuff. While you're reviewing the chart, the ICU clinical pharmacist would be already identifying problems, like there's some sort of nephrotoxicity happening here, or there's a drug-drug interaction happening in that patient. So you will be writing down certain drug-related problems as you go, and then around 8 to 8:30 in the morning, rounds will start, and they will call for you to attend the round. If you're not around, they will call you. Trust me, whether it's ICU or any other unit. And here comes your main need. They will be asking you multiple drug information questions, and you will be giving them lots of information, such as therapeutic drug monitoring needed in this patient, a dose adjustment is needed in another patient. We need to switch this patient antibiotic or beta blocker or whatever medication to another medication, which would be more beneficial and have better outcomes in those patients. Once you're done with the rounds, you would gather all that information that you recommended in round and document it in the electronic medical record or the chart or whatever documentation method you have at your hospital or clinic. Finally, throughout the day, you'll be visiting the unit multiple times to follow up the therapeutic response and lab changes on patients and making other recommendations. And maybe those patients will have consultations from other departments, such as the surgical department. And maybe those surgeons would make other recommendations, such as switching anticoagulation or stopping antiplatelets or doing this or doing that or switching antibiotics. So you will be around to help with recommendations on which is the best drug to use and the best dose and route of administration as well. Now, let's move on to the interview for a clinical pharmacist. So this is a very, very tricky part, and we go through extensively through the clinical pharmacist interview in our complete course on the website. But I wanted to give you sample questions that you may be asked in a clinical pharmacist interview anywhere in the world, not necessarily in Canada or the United States, but anywhere in the world. If you are going for a clinical pharmacist interview, you probably are asking yourself, oh, what are they going to ask me? I wonder. Now, here are some samples for clinical pharmacist interview questions, such as what is your approach to handling a drug-drug interaction, for instance? How do you manage a patient with renal impairment on vancomycin? Describe a challenging clinical case you handled. And this is a very popular question, by the way. It helps the interviewees to determine whether or not you actually have the experience and the education as a clinical pharmacist, and you've actually practiced as a clinical pharmacist for quite a long time. Because if you didn't, you wouldn't have a challenging patient. Another question is, how do you stay updated with recent guidelines, for instance? How do you handle conflict with physicians regarding therapy choices? And yes, some clinical pharmacists will have conflicts with physicians. We're not angels. Some of us are really arrogant. Some of us just want their recommendations to be followed without thinking from the doctor's point of view. And there will, at sometimes, there will be conflict between a clinical pharmacist and a physician, and you need to manage that in a very professional way, which we also teach you in our complete course. So for all these questions, there are many other questions that we go through and we help you answer in our complete course. But I wanted to give you just a few samples because I get a lot of questions on this, and how do we pass a clinical pharmacist interview. But if you want the extensive training, you should probably sign up for the complete course, because we have two large videos explaining every part of the clinical pharmacist interview and how to answer all of these questions. Some of them are clinical questions and some of them are personal questions as well. So that's on our complete course on the website clinicalpharmacycourses.com. Now, this is a sample practice clinical pharmacy cases, which you may also encounter in an interview, but also to show you some examples of what you will encounter in your practice as a clinical pharmacist. So case one is an ICU patient with septic shock. The reason for admission is that the patient has a septic shock. It's been already diagnosed on admission, and septic shock is one of the problems or disease problems that get identified and diagnosed immediately on admission, because there is a certain steps that you have to follow right away within 1 hour. So the questions here would be, what initial management would you recommend? What consideration would you keep in mind? Now, these patients are very critical, and the risk of mortality is very high by the hour. So you need to have a plan already in your head before the patient presents to ER or to the a clinic or wherever the patient is presenting. Case number two is about a patient on warfarin with an INR of 5.2. They presented to ER or to the clinic. You measure the INR through the lab facilities, and you find out that it's 5.2. What would you do? How would you manage anticoagulation in this patient? And what would you recommend? Would you recommend an antidote, or is there something else that you would recommend? How would you manage this patient? Let me know in the comments, by the way, if you have information on any of these questions. Case number three is about a diabetic patient with recurrent either hypoglycemia or hyperglycemia or diabetic ketoacidosis. How do you manage these patients? How do you evaluate their medication regimens, diet, renal function, drug interactions? What are you looking for, and how do you treat it? Every one of these, by the way, have different treatment guidelines, so you need to be careful. Again, let me know in the comments if you have had experience with such cases before. And case number four is about a newly diagnosed DVT in a pregnant lady. What treatment approach would you recommend, and what are some of the contraindicated medications that you should avoid in this patient? And as you all know, pregnancy is pregnant women are very vulnerable, and we cannot really use every single medication on them. So again, you might get this question. In this case, wherever you practice, you gotta be prepared for similar cases. I think this concludes our free clinical pharmacy course. If you have any questions, please feel free to leave me a comment in the comment section. Thank you all for attending the free clinical pharmacy course today. I hope this was helpful and useful for a bunch of you. And once again, if you want more extensive clinical pharmacy knowledge and information and training, please make sure to visit our website www.clinicalpharmacycourses.com and sign up for the clinical pharmacy course. It's a complete, extensive course in clinical pharmacy with lots and lots of didactic information, lectures and presentations and quizzes. And also for the second part of it, you have a complete practical course residency training that will help you practice clinical pharmacy as if you are at a hospital or at a clinic. And then you will also get trained at the end of the course on how to pass the clinical pharmacist interview. So it's a very extensive course that covers everything, and it's a unique course that achieved excellency in clinical pharmacy teaching from Canada and from the United States, and is currently under evaluation for accreditation from ACPE and CSHP. So it's a one of a kind course that is not really offered by any other organization. I would really encourage anyone who is willing to expand their knowledge, advance their career, or they are actually willing to start practicing as clinical pharmacists to join the course today and start learning. Thank you again for watching our video and our free clinical pharmacy course today, and I'll see you in the next video.